heard that animals, including our pets, contribute to antimicrobial resistance. How does that happen?
Hi, Chris Hull, Wake Forest University School of Medicine, Infectious Diseases. Antibiotic resistance and problems with antibiotic resistance isn't just in humans. It affects animals too. And this even includes our companion animals, our dogs, our cats, and maybe even our rabbits if we have some in our household. But the biggest problem is in food-producing animals. Antibiotics is added to the feed of a lot of the animals that we consume, pigs, cows, and this promotes their growth so that they can get to market faster. So there's an economic advantage to the food-producing companies. The problem is because of the low-level exposures to these antibiotics, the animals develop resistance determinants in their intestines and colons, and then out it comes in their poop, and then this gets spread out in lagoons and on fields and such. And so antibiotic resistance determinants actually can spread in the environment in these instances. Also, if you're eating these animals, such as you decide to have some chicken at home, and the chicken isn't perfectly cooked, you can pick up some of the bacteria that comes in on the chicken that we buy in the grocery store. And there are actually studies to show that chickens that have been given antibiotics have a higher rate of antibiotic resistance cultured from that chicken, and that the people who pick it up have a higher rate of having antibiotic resistance determinants such as an enterococci in their stool. So we really have to work harder and to get antibiotics out of our food-producing animal chain. Europe doesn't do it anymore, and they've shown that the economic disadvantage is really minimal, and they're still able to get their animals to market on time. Also, as consumers, we need to make sure if you have a chance to get antibiotic-free meat, you go for that, and then to make sure your food is cooked well and that you use good hygiene practices in your kitchen to not distribute these organisms into our own personal food chain.
The use of antimicrobials anywhere, such as in a hospital, a veterinary clinic, or on a farm, can contribute to antimicrobial resistance, making infections in both people and animals harder to treat. Transmission of resistant organisms, particularly pathogenic staphylococci, occurs between pets, owners, and veterinary staff, and pets can act as reservoirs of such bacteria. This may have an impact on the use of antimicrobials in human medicine. However, the most critical causes of antimicrobial resistant infections in humans are the misuse and overuse of antimicrobials in humans and farmed animals. The rising global demand for food of animal origin encourages the increase of animal production worldwide, especially in developing countries. Simultaneously, current farming practices often extensively use antimicrobials on animals, influencing the incidence of bacterial antimicrobial resistance in humans, animals, and their environment.